Good evening, and
Chitra madam, we can't hear you.
or even intellectual status, please mute. It is unrelated to socio-economic status, academic status, or even the intelligence of family. With this webinar, we will be able to understand the intricacies from the experts. And now I hand over dais to coordinator Dr. Nilima Bhandarkar, our treasurer of Raigad AHA.
Thank you, Chitra
Dr.
madam.
Nilima.
Welcome all to this webinar on the day of Autism Awareness Day or Week. And this year also we are celebrating it with getting some more information about autism from all our experts. Dr. Vikas More is our Raigad IIP president and he'll like to say one or two sentences.
Hello, I welcome all on the behalf of IIP Raigad and AHA Raigad. First of all, I welcome Dr. Respected Geeta Patil Madam, who is the chairperson AHA. And we are very fortunate to have Dr. Jayashree Shivalkar Madam from Nagpur, who is a consultant development pediatrician. And she will be guiding us for the all aspects. And our own Shilpa Gandhi, who is doing a very good developmental work in our area, she will be talking on this very important topic. So we are actually celebrating the World Autism Day, and the today's topic's name is Breaking Barriers, Nurturing the Neurodiverse Teens. So whenever I watch any autistic child, it reminds me of a star in the universe which is still not explored, and which is so beautiful. But sometimes these days I am sometimes scared of diagnosing the autistic child and giving a label that he's autistic and he can't do so many things. So it really shatters the courage and the faith system of a family. And personally, I feel that the actual way of handling an autistic child should be amalgamation of the role of a developmental pediatrician, general pediatrician, parents, then the friends of the child and the teachers, and along with the society. Because it reminds me of a movie of Dr. Dilip Prabhakar, where he says that "Mi asa kasa vegra vegra." So he has really acted very well in that, and he has shown us that how these kids can contribute to the world in a better way. I heard that Leonardo da Vinci was also had a autistic features, and it scares me that if he would have took birth in today's time, and his parents would have been told that he can't do this and he can't do that. So whether he would have been able to give that much value to the world that he has given in those times. So overdiagnosing in autism is a really threat sometimes, I feel. That spectrum should be taken in a very wise way so that kids should have the adequate support system from the society and family, and obviously from the medical fraternity. Thank you so much, Chitra Madam and Nilima Madam, and also Shilpa for choosing this very nice topic on this day. It is a very nice way to celebrate the World Autism Day. And I congratulate all of you. Over to you, Dr. Nilima Madam.
Thank you, Dr. Vikas. Well said. We need to handle autism, or as the topic name suggests, neurodiverse teens or children carefully, diagnose carefully, and let's learn how to handle them, how to help them progress with all these three experts. Today we have Dr. Geeta Patil Madam as our first speaker. She is Central AHA Chairperson. Madam is practicing in Bangalore as consulting pediatrician and adolescent health specialist. She was president of IIP Bangalore in 2017, CIP EB member in 2020 and 2022. She has multiple publications and conference presentations to her credit. The another speaker, she's our own member, Dr. Shilpa Nambiar Gandhi. She has done her MBBS from St. Petersburg, IP Pavlov Medical University. She has done her diploma in child health at Mohite Sir's Amrut Medical Foundation, fellowship in neurodevelopment and behavioral pediatrics at Nair Hospital. She is currently working at Paramount Hospital Panvel, Sai Child Care Hospital, Little Krishna Hospital Ulve, and Colors Hospital Khargar. And the expert today we have is Dr. Jaya Shivalkar Madam. She is a developmental pediatrician from Nagpur, child and adolescent counselor. She is life skills trainer also. She runs a child development and activity center in Nagpur. She is a CWC, that is Child Welfare Committee member of Disability Board. Well, I welcome all of you to the activity, today's activity, and let's learn more about neurodiversity. Over to Geeta Patil, madam.
Thank you very much, Nilima, for such a kind words. Can I share my screen?
Yeah.
So at the outset, let me thank IIP Raigad, AHA Raigad. Just now, Vikas More sir has given us briefly told what are the problems for us. And special thanks to Chitra Kulkarni, who is chairperson of AHA Raigad, Sunita Ingade madam, who is a secretary, Neha Singh, joint secretary, and Nilima, who is a treasurer. I think IIP Raigad and AHA Raigad, always they are in forefront of academic activities, we know. But my special presence here is, let me confess, I'm not a neurodevelopmental specialist, but I'm a national coordinator for IIP Ki Baat Community Ke Saath. I think all of you would have heard what is this. This is a IIP action plan. It is a brainchild of our respected President, Dr. Basavaraj, and President-elect, Dr. Khalatkar sir. See, all of us, we know that IIP is very expert in training our fellow pediatricians, PGs. But our goal is to improve the child health and achieve that goal. Is it only clinic is enough? See, you are diagnosed autism, but you are not created awareness in the community. So the proper management doesn't happen. So this is a novel and noble gesture of IIP to have this IIP Ki Baat community ke saath. Yesterday, there was a launch of this Autism Understand and Empower. So yesterday was a World Autism Awareness Day, and theme is a color. What does it mean by that? It is to honor and cherish the diverse spectrum of abilities and experiences of autistic people. So now the time has come for us. Let us not think only survival or just coping up with the autism after the diagnosis, but it is a thriving. What is mean by thriving? See, all of us caretakers have to create an environment where the autistic individuals will flourish. So this is the intention of Indian Academy of Pediatric IIP Ki Baat community ke saath, and everyone can use the scientific material which is given yesterday. I think you can utilize, if you use this material, you can talk to the press, you can talk to in the conference, you can talk to pediatricians, medical officers, ANMs, ASHA workers, even ordinary your staff, you can talk with this. So this is the intention. So we create the scientific content with the help of the experts, and experts are really, these slides, if you see, or some videos, what you have seen, they're really very high standard, and the scientific material is totally non-compromising. And I liked this flyer, and especially as a AHA chairperson, I like this breaking the barriers, nurturing neurodiverse teens. Why it is nearer to my mind is because our theme or mission of this year is reaching the unreached adolescent. Definitely you are reaching the unreached adolescent by conducting this program. Many of the neurodevelopmental teens, neurodiverse teens, and others, so many like tribal, rural, they are not reached by us. We talk a lot, but we don't reach them. This is the way we can reach them. So we plan a action plan in ABCD, create the awareness, consult the pediatrician, beware of the screen. I'm not going to go into detail to talk. We have got experts, but I want to create your awareness. This program is for all of us to go to the community, talk to your parents. If these slides also, if you show to your parents or anybody who wants to ask you questions, just after your clinic also, you can just browse and talk to them. So just now Vikas More sir told, it is a spectrum. It is not a fixed anything. There is a mild to severe symptoms. And many times there are comorbidities. I am not going to go into scientific jargon because Dr. Jayashree is there and Dr. Shilpa, they are going to discuss. All of us, we know there are core deficits in 2 domains. I am talking so that you understand how the community to be reached. Definitely, many of us have got tremendous knowledge, but we don't reach to the community. This is a great way for us to reach to the community. All of us, we know the core deficits in 2 domains are social communication, interaction, restrictive, repetitive patterns of behavior. And obviously, we pediatricians, or maybe when you talk to the medical officers, we can, overdiagnosis definitely is happening. I don't deny about that. But a very simple thing, poor response to name call by 1 year of age, no meaningful word by 18 months of age, does not play with toys appropriately, fixed pattern of interest or activities. You have seen them clapping or rocking, and their interaction with the peers and friends is not there. The odd moments you see, they go on repeating the word. Sometimes parents are very happy that they can chant the shlok so well. They can tell the rhyme so well. They can grasp the advertisement so well. So there are certain things which we have to remember. The children may be shy, sometimes hyperactive, they will be toe walking. Now, when you told about the neurodiverse teens, let me come to this point. So adolescents with the autism spectrum disorder, usually the diagnosis would have happened. And maybe some milder variety rarely may be missed. Usually it is not happening. See, if their social difficulty depend on their cognitive and communication abilities, we should know that 30% of them, they're not up to the mark. They have got an intellectual disability. But let us not talk in a negative way. Even the ones with a good verbal may face difficulty in understanding social rules of friendships and navigating relationship. They take the things literally. If you tell them, oh, come at 5 o'clock, if you come at 5 also, they will be disturbed. They fail to understand the sarcasm, teasing. They're so innocent, nice people. And I think that Marathi movie I have not seen, but that Shah Rukh Khan's movie also, it is autistic. My name is Khan or something. But there are certain things they dramatize. Let us be practical. They get upset if rules are not followed. And many times they are with high risk for anxiety and depression. So we have to remember them, how to tackle these adolescent problems. And these adolescent problems, why I am telling, when you say that you are going to understand and empower, when they reach to the adolescent age group, definitely all the problems, sexuality, other problems, puberty, growth are same. There is nothing different, only their communication skills. And if they are intervened early, definitely they will be near normal. And then differential diagnosis, which obviously will be discussed later, the hearing loss, selective mutism, global developmental delay, ADHD. You can differentiate very well. Hearing loss, social communication, nowhere get disturbed in these things. And global developmental delay, definitely, obviously, there are many things are there. MCHAT, we have learned. MCHAT in NCECD, 18 and 24 months of age, very simple. It is available online also in different languages. 10 minutes it takes for parents to fill. It may be pass, fail, yes, no. Then revise, follow-up also is there. But there is a 30% false positivity is there. But at least you detect some neurodevelopmental problem. It may not be specific for the autism. So that is a screening test. It's not a confirmatory test. So confirmatory test, it is mentioned, it goes under domain of neurodevelopmental pediatrician, INCLAIN, and INCLAIN is International Clinical Epidemiological Network. These are the standard things, or DSM-5. When they have to have a disability certificate, please remember, which we don't learn when we are talking in the conferences. DSM-5 and INCLAIN is required. And Indian scale for assessment of autism is very much to be certified to get a disability certificate. Why disability certificate? Rights of, they have got a rights. And those in education, social life, job, everywhere they can avail this. So that is very important for us when you talk to them. There's no need of having a battery of investigation or tell them your child is not going to be normal. Don't give these type of statements. So that is very important thing to be told. Obviously, blood count or hemoglobin and thyroid function tests, but not required to get into all detailed investigations like metabolic testing, biomarkers, lead levels, not required. Neuroimaging also many times they ask, oh, he's not doing well, should I get MRI? Unless there is a neurological examination is abnormal or there are convulsions or delayed milestones or regression of milestones, we don't need to get it done. We have read about the fragile X syndrome. The moment they come to us, oh, chromosomal analysis, male child, is it required always? Obviously, the diagnosis is written on the face because of the dysmorphic features. So management, I am telling this has to be told to not only pediatrician, but everyone. That simplified way it is prepared. So intervention is on the target core features of autism. We have to understand the basis. We should not target the symptoms of delayed speech and hyperactivity. I have seen many times, they feel that there is some hearing problem and speech therapy without going to the developmental pediatrician, parents start themselves. So that's wrong. And our pediatrician's duty is to tell them, ki Baba, these type of management definitely is not going to help. It should be holistic. It should not be symptomatic. Now, new revised autism guidelines are going to come up. I think yesterday, if anybody has attended, they know that intervention is should be done in home and community, not merely based on the clinic. But what message we should give? Screen time, no screen time below 2 years, increasing play time with caregivers. So I think some developmental pediatrician I was listening told that one lady joined for the work at the age of 4 months after her pregnancy. And the child started not responding to her. She got scared and she felt her child is autistic, went to neurodevelopmental pediatrician. And neurodevelopmental pediatrician, as usual expert, could maintain the eye contact, could play. The child played with the father and grandfather. Means why? What was the thing? The mother was not interacting with the child. So management of the comorbid conditions are important. Pharmacotherapy, let us not talk. At least I am not an expert to talk. Pharmacological management of convulsion, gastrointestinal disorders should be done properly. And treatment program, hand-holding should not be left by the pediatrician. Why I am telling you, many of them have got a myths in their mind, false concept. Many of you would have seen they don't take vaccination the moment you declare the autism. Especially, I have seen recently a child having a chicken pox when father had a herpes zoster, this autistic child, because child was not vaccinated. So we have to explain to them that there is no research doesn't show this, that there is any relation between that. Same thing is about the diet. When you talk to the neurodevelopmental pediatrician, they don't talk about that. You should not tell that coloring, preservatives, additives, that type of food should not be given. And in case there is a ADHD or hyperactivity, maybe little sugar should be moderate. Other than that, diet and vaccination should not come in the way. And now there is a craze in metros like Bangalore, Mumbai. There is a stem cell therapy, high dose vitamin A. It may not be useful, but sometimes it may turn to be harmful. So we should be remember, treatment program should be monitored. So I already summarized what is the role of a pediatrician. See, when you talk to the parent, don't give them that hopeless thing. We know that the parent usually asks, what is the possibility of second child? All of you know 10%. If there are two children, 34%. These are all theoretical things. Gently should be told. And appropriate referral to developmental pediatrician. I know that when I am talking, people from periphery are going to ask about this. But somehow developmental pediatricians numbers have to increase, and obviously it is increasing, and it is a need of the day. And we should, now my last point, I don't think we discuss these things to the autistic children parents. See this, according to the National Trust for Welfare Persons with Autism, Cerebral Palsy, Mental Retardation, and Multiple Disability, there are various schemes are there which we have to make them aware. It is not very easy to avail those facilities, but we should strengthen these facilities for them. I know that there are certain neurodevelopmental intervention works out expensive for them. Niramay is an insurance, early intervention, Gyana Prabha scholarship is there. The notification that I think all of you know, the Disability Act is there. And before that, the DSM-5 and incline tools have to be applied. And how many years the certificate will be valid for period of 5 years, below 18 years of age, and temporary disability, that is a temporary. After that, you have to get a permanent validity on their certificate. Just now, Vikas Mori sir told. So let us see who was Greta Thunberg. Greta Thunberg was an environmentalist, just 15 years old girl from Sweden. And what did she so? She was so focused on one thing, climate change, global warming. And she fought against the government, and it has taken up. And our Albert Einstein, obviously, Albert Einstein, and I think now the youngsters will get very much connected to Elon Musk. He himself told Tesla that he is autistic, and his autistic feature has turned out to be a blessing for the world, right? So let us utilize the positive things. There are some Indian children like a Pranav Bakshi, who was a model, who is a model. Now also he's a model. There are some like who has ran marathon. There are many of them are there. They pursue their things. Depends on us to encourage the parents, encourage many. They can be fruitful to the society and themselves, to the family and community also, if we do these things. So these are our social media sites of IAP. I think whenever you get any IAP's mail, at the end, this is there. If you would have observed, just click it, and there are posters are there, reels are there. And these are the things you like and share. And why it is I'm telling IAP, it is a really a great thing. When you want to have some reference, always WHO and UNICEF comes. So this will leave IAP's digital footprint also. We are 44,000 IAP members, and we have to make that attempt. See, whenever you find out a reference for anything, where from you get references, when now chat GPT also, you see the references are still not IAP. This will increase our digital footprint. So this is the advantage of using the social media. I am not telling that, but social media once in a day, just to share our posters and reels, will propagate the knowledge properly. And nobody can deny, we learn a lot from WhatsApp University, from so many things. I'm very sure many of our doing, and community is also learning. Maybe print media, newspapers, reading has reduced, sale has reduced, but social media, it has increased. So let us share in school groups, community groups. All these things can be done, and beautiful posters and reels are there. That's all I want to tell. Thank you very much, IPAHA and Raigad, for giving me opportunity to express as a national coordinator for IAP की बात community के साथ. We are coming out with different types of things. So that's all I'm ending here. And if anybody has got any doubt about these things, they can just inform us. So we can clarify their doubts. Hope I have made it clear to everyone that our knowledge should not be confined to only clinic. Let us go to the community, then only you will improve the child health. And our we should thank IAP, President-elect, Treasurer, Secretary. All of you know them. It's a real program going in a mission mode, and it will help everyone. And I can see IAP Raigad and AHA Raigad is always in the community activities I have seen. This is definitely a good thing for everyone. Thank you very much.
Thank you, Geeta madam. It was wonderful presentation made by the IAP. Few of the posters we can display in the clinic so that when they are coming to us, we can start talking about it, and it can reach more number of people or children. Now, next we are going to learn about this autistic teens or neurodiverse teens from Shilpa madam. Welcome, Shilpa. You can start your presentation.
Okay. Good evening, ma'am. Just give me a minute. Is my slide visible?
Yeah.
Okay. To begin with, I would first of all like to thank IAP Raigad, AHA Raigad, Dr. Chitra Kulkarni ma'am, Dr. Nilima Bhandarkar ma'am, Neha ma'am, and Sunita ma'am for giving me this opportunity. So now that this year's Autism Awareness Week's theme is colors, which means we need to it means autistic voices, empower autistic voices. It means to raise awareness amongst and raise awareness and provide support and power to the individuals with autism. So today's my topic would also be in about nurturing the minds and development of neurodiverse adolescents. So when we say neurodiversity, it is not a medical terminology. It is a term which was coined by an Australian sociologist, Judy Singer. She coined it to promote equality and inclusion amongst the society, because we know that not everyone's brain works in one certain way. So it is wrong to call someone normal or abnormal. So to decrease that, they introduced the term of neurodiversity, and it benefits in inclusion. So when we say neurodiversity, all the children with autism spectrum disorders, ADHD, learning disabilities, IDs, they all fall into this umbrella term of neurodiversity. So when we talk about adolescence is a age where the body undergoes significant changes in their physical, cognitive, emotional, sexual development. There is a more abstract and more logical way of thinking that begins, and these these adolescents demand autonomy. So globally, when we see mental disorders, adolescents have a prevalence of 20% of the adolescents are supposed to be having some kind of mental issues. But in India, we have only 7% that is reported. And we see that the prevalence of children with ASD has significantly increased because of the awareness. To 1 in 54, it was in 2020, but according to the latest CDC estimates, it is 1 in 36. So why is it important to know about this? Because the prevalence of mental health issues in an autistic child is way more than their neurotypical peers. So as we see, ADHD is 28 times more prevalent in autistic children than compared to 7.2% in the general population. Same goes with anxiety, conduct disorders, depressive disorders, and OCD. So it is very important that we know about the children, about these neurodiverse adolescents. Coming to quickly brushing through the DSM-5 criteria of autism spectrum disorders. So as we all spoke, it has their core deficit is in two main components: persistent deficits in social communication and interaction, and restricted repetitive pattern of behavior, interests, or activities. So when we say deficits in social communication, there are deficits in social emotional reciprocity, non-verbal communication, and developing, maintaining, and understanding relationships. So to fulfill the DSM-5 criteria, all three of these contexts has to be affected. And when we say about restricted repetitive patterns of behavior, there are stereotyped or repetitive motor movements, use of objects or speech, adherence to a routine, abnormally high restricted fixated interest, hyper or hyporeactivity to sensory input. So any two of these four is enough for fulfilling the DSM-5 criteria for calling it ASD. The guideline being, it has to be present from the early childhood as the child meets the social age, and it is causing significant impairment in their functioning, and it is not better explained by any other it is not better explained by an ID or hearing loss or any other issues. So in adolescence, how can we see these core deficits? So when we say social communication and non-verbal part of social communication, non-verbal means the adolescents at this age, they are not able to understand non-verbal clues, like when we use facial gestures for different things, or for communication, how while speaking our voice go up or down during certain contexts. So for these children, they have something known as vocal intonations sometimes. So this they are not able to do. It is difficult for them to make an eye contact. So these are non-verbal gestures which are difficult for them to use or understand. Difficulty with abstract thoughts, inability to listen to others because of their fixed ideations. Sometimes they can talk about things, but they don't understand if the person in front is interested to listen or not. There are problems managing appropriate social interaction and misinterpreting of cues. So they don't understand sarcastic comments. It is difficult for them to understand these things. The other thing is restrictive interests and repetitive behaviors. So even a small change in their routines can cause extreme amount of stress or anxiety. Small change in their routine is the child goes to school through a certain route, but for some reason, if the route is closed for construction or something, it causes him a lot of stress when they take another route to go to their school. So these kind of small things can also cause a lot of anxiety in these children. They have specific areas of interest. If a child is interested in the solar system, he can talk about solar system. If the topic is being changed, he will try to come back to talk about solar system. There are sensory sensitivity. So sensory sensitivities can be in both ways, hypersensitivity or hyposensitivity. When we say sensory, it usually we talk about auditory, visual, olfactory, tactile, vestibular. So they can have a wide range, like they can be either sensory, they can have certain sensory seeking behavior or sensory avoidant behavior. For example, if the fan, while it rotates, it makes certain kind of sounds, but we are used to it. We don't have a problem with it. But a child who is hypersensitive to auditory stimuli, so for him, that sound is like something like a home theater going loudly. So for him, it is disturbing. And same way, if he has a seeking behavior, so it can go, he can be more wanting to have those kind of sounds. They sometimes have problem in their executive functioning, like issuing of issues with organizing tasks, planning time effectively, initiating a task, or transitioning between tasks. So for example, when a teacher says in the class, after you finish writing, you have to take out your maths book and open to page number 84. So they would be somewhere lost in there and they won't be able to transition between those activities. And they need some extra stimuli or help and they can function better. So because of these issues, they have features of anger, anger issues, aggressive behavior increases, anxiety, depression, all causing some sleep issues. Externally, what they face by the society is there is increased dependency. The parents feel that they don't have enough. They cannot be left alone or they cannot be given any tasks. So they are given very less chance of autonomy. Educational opportunities because of lack trained special educators or appropriate teaching material, or the family's perception of not wanting to, that the child cannot do it and not wanting them go for higher education. These are all limiting factors which decrease which stop them from achieving their milestones. They even have some medical comorbidities like seizures. Seizures are 20 times more seen in neurodiverse children than in the neurotypical, and they are even more common in adolescents who have ID. Sleep disorders are from 40 to 80% of the adolescents have sleep disorders, and which affects their functioning, increasing the irritability and fatigability. GI disturbances like constipation, GERD are increased in the children with in adolescents with ASD. ADHD and anxiety disorders are present. So because of poor social skills, emotional dysregulation, socially inappropriate behavior, what they feel is poor self-esteem. They are usually bullied by the peers. depression, aggressive behavior increase. So how we can tackle this is by creating an awareness amongst the parents, teachers, community, empower the adolescent for self-advocacy and an empathetic support from the peers. Sometimes a child who has more of ADHD or LD, so what happens in school is they perform poorly. They have which causes for lower self-esteem, which causes depression or risk-taking behaviors. At home, they are usually labeled as difficult, lazy, or inattentive, which causes them to be rebellious or defiant. And same among the peers, there is no empathy or there is peer rejection. They don't have any friends. They are bullied frequently. So appropriate support at all these areas would help them in coping up with their functioning. Another major change that happens in adolescence is puberty. Puberty is a challenging time for any child, but for a child with autism, it is even more difficult. The children with autism may have difficulty in understanding those social cues and may struggle with the routine. The changing body is also sometimes a cause of sensory issues which increases. So it is very important for the caregivers to provide clear, concise information about their physical changes that is occurring during the puberty. This information can be provided in an easy way for the child to understand. So sometimes visual aids such as diagrams, videos can be helpful in explaining these changes that is happening to help the child identify and express their emotions, as well as creating a safe and supportive environment to explore their feelings. Another major change that happens is the start of menstruation. So autistic children may need time to understand and adjust to the physical changes of puberty. So it is a good idea to start talking early about periods. Reassure them that it is not dirty but a part of growing up. You need to teach the girl to take care of herself, about proper cleanliness, and it is always useful to teach these things by the help of social stories or some picture flashcards. So social stories are you talk about a person or about what is going about the sequence of things that are going to happen. So when their body changes, there can be, she may have a start of bleeding, which may come every 28 days. It may last for 4 to 5 days. You may have some stomach pain, and how to adjust with emotions at that time. Where can she talk about? Whom can she talk about? Talking about these things earlier will be helpful for them to adjust. The other thing that can be done is pasting those flashcards in the washroom, so that the issues with transition or what comes next is easier for them to see and do. Similarly, in boys, night emissions is a normal biological phenomena. So you have to teach them how to clean themselves, diverting their attention if self-stimulation is happening in public, teaching them properly what activities can be done in public and what has to be done in a private area. If they are in public area, you have to keep them occupied, or during the day, keeping them occupied in some recreational activity or vigorous sports, help them take off their mind and help them organize themselves better. Show of affection is one more thing that is sometimes we have to deal with in the adolescent children. So the adolescents who has some sensory seeking behavior, tactile seeking behaviors, so they go very close, they stand very closely, hug people, or they have an exaggerated body language. They don't recognize boundaries and can speak about everything to anyone. So parents and teachers need to understand these and teach them about expressing their emotions, what kind of greeting to be used while addressing others, discourage expressions of affection through physical contact, and teach them to distinguish between close family members and outsiders. So someone with so it highly depends on the functional level of the child on how we have to teach certain children. So someone with a normal IQ or with only mild ID, they are capable of understanding the functions of the body. So you need to teach appropriate behaviors by giving experiences like family picnics, taking them to gatherings, religious functions, and giving them those experiences and teaching them. For someone who has moderate to severe ID, habit training is the utmost importance. Teaching good habits, instill a sense of privacy, and teach them appropriate ways to greet others is would be the idea. So we need to promote better mental health in these adolescents, not by making them socially isolated but by encouraging social connections, increasing social motivations by indulging them in enjoyable interactions, increasing their autonomy, give them small tasks in which they have to decide things for themselves, uh, which builds on their self-confidence, build on assets by recognizing their strengths and talents. Supporting this adolescents with ASD. So by the time they are adolescents, they're already been diagnosed and they're way into it. But early intervention means sometimes some children, very few, they are diagnosed at an later age. So early is as soon as we pick them up, you have to start intervention. Individual education plan, because every child is different, every child's needs are different. So you have to make an individual plan for each and every child according to their functional levels and sensory needs. Social skill training is very important in adolescence, and sensory integration and maybe accommodations if necessary. How can the parent and caregiver help at this stage is by establishing a routine and structure for the child. Children with ASD always work better when they have a fixed structure to their day. There has to be a clear communication, point-to-point explanation of what they need to do, because sarcastic comments or just assuming that they would understand is something that won't happen. Encourage them to be independent, provide an emotional support. What can educators do is by creating an inclusive classroom, use of visual supports for the child to be stimulated or to understand what is going to come next, incorporate special interests, and implementing positive behavior support. Peers acceptance can be increased by peer education program, encouraging empathy and involving peers in social activities. Something which is very important is caring for the caregivers. Many of the children, adolescents, children with autism, their parents have have depression or anxiety about the future of their children. So family counseling, having a support group is very important. Educate the parents about neurodiversity, about all the schemes that are present is necessary. Collaborative goal settings with the therapist, with the pediatrician is necessary for the parent to understand what they have to do. And it has to be something that the parents are agreeing to do. If we have some unexpected goals which is not possible in their settings, then we are not doing the correct work. And respite and relief services, if the child is too dependent, is necessary for the parents also to get a break. So my take-home points for today would be try to have independence, starting with daily living activities to be focused, personal hygiene, cleaning, feeding, then teaching small finances to understand what is money, how it is used, encouraging independence. Identify the strength of individual by creating an inclusion, encourage self-advocacy, and family counseling is utmost important. Mental health of the caregiver is also to be taken care of. So I would like to conclude by saying that everything has a reason, every behavior, and don't think there is a different or a better child hiding somewhere. Love the child in front of you, encourage the strengths, celebrate his quirks, improve the weaknesses, the way you would with any child. Thank you.
Wonderful presentation, Shilpa. Was very nice. Exactly what we need to know. The pediatricians, educators, parents, what we need to tell them, you have indicated in small and to the point. Your slides were very correctly telling us the things to do. Now I want Jaya madam to give her expert comments about this neurodiverse teens.
Yeah. So good evening, everybody. First of all, thank you so much, IIP Raigad, Dr. More, and AHA Raigad, Dr. Chitra Kulkarni, madam, for giving me this opportunity. Regards to Dr.
Ma'am,
Geeta
please stop. Ask her to stop share.
Yes, ma'am.
Dr. Shilpa. Yeah.
Regards to Dr. Geeta Patil, madam, it is great to share dais with her. And Dr. Shilpa has really given us a broader view and a very nice view. And it is a great achievement on part of IIP, because it was just few years ago that we were taking workshops regarding the how to suspect ASD and how to diagnose and how to assess. And now here today we are speaking on neurodiverse teens, that is teenager maybe with autism. So it's really good to see that, and all other pediatricians who were not into developmental pediatrics are also getting interested and educated. So this is really great. Now I have been practicing developmental pediatrics past 20 years. So now the children I was treating as children are now into their adolescence.
Right.
I will just share two cases here in very short and highlighting how the therapy have made a change. So I have a student who is 24 years old. He is high functioning autistic and he is now doing MBA. And right from his diagnosis, and his diagnosis was like telephonically his mother told me, "Madam, मेरा बेटा बात कर रहा है पर वो repeat करता है." So telephonically I suspected at that time 20 years back, and then I called them. And mother is like a parallel situation with me. Like I am also telling her something, she is also educating, she is also getting aware. Every problem she is discussing, we are planning the strategy, and he is quite well adjusted now and is in last year of MBA. But point to focus is that all through these 4 years when he was in a professional college, he has been under a lot of stress because of his social communication deficit. Whatever Shilpa madam has told, inability to understand the social language, social cues, social environment, all these points I have actually seen in him. And we have been, and child, I'm not a child anymore, but he has been actually in touch with me. Like he'll just send me a message, "Madam, I'm disturbed. Madam, I'm angry." Up to I'm feeling suicidal. So that is the mental state they are going through. And with the parental guidance, now he knows that he has someone to talk to him who understands him perfectly. I have discussed this case with the MBA in charge in their college also, and I have made it a point to talk to his friends also, because I just told them that you need to be little more accommodative, inclusive, and sensitive, because he's an intelligent child and he's absolutely not disturbing to you and not competitive to you in any way. Just when you are going for a coffee, you call him, "Aa jao hamare saath." But that has also been a challenge. The road was not so smooth, but with parents and he himself being aware, "Madam, मैं mental हूँ क्या? मुझे क्या हुआ है?" So likewise, he's asking, and now he's coping up, and now he's appearing for final term. In contrast, there is one 17-year-old child, teenage, again a high functioning, but the parental focus was only on academics. So it was only like rote memory, इसको पास होना है, इसको individual tuition लगाया, मैं इसकी history पढ़ती हूँ, मैं इसको word to word science पढ़ा रहा हूँ, and thoroughly obsessed with the academics. He has now passed his passment, appeared for his 10th, and now parents are partially relieved of that academics part, at least for 2 months. But now the child is so aggressive, so angry, and completely into his digital world that it is very difficult for parents to tell him even one instruction. So this is this case I wanted to discuss to show that how the parental approach, and this is very common who are dealing with autism. They know that moment the child enters the school, everything is shut off and only school, academic, CBSE, that is their only criteria for child's management. So here I think lies the role of pediatrician, who has to be with the parent, and he has to emphasize on the need to give other therapies, social exposure, social interaction. All these things are very important. Another case is a child who is high, who has high on spectrum, like what we can moderate autism. He is now 17 years old, 18 years old, and the special school is now shifting him to vocational training. But what parents are saying, what is the use of spending money now on his vocational training? Because we know he is not going to do anything, and we are okay if he's at home. We'll give him some medication to sedate, and we don't want to educate him. So sometimes therapy is available, but the parental attitude is not so responsive, and they just give up. So again, counseling part, making parent aware becomes very important. Another which is important aspect which I would like to highlight here is, moment we diagnose ASD, maybe it is your first time or the child is coming to you at 8 years, 10 years. Whatever we tell the parents ki ASD to rahega, there is no medication as such. But such random statement will just take the parent away from you. And definitely he will go to another pathy. And more, in fact, Ayurveda and homeopathy and the so-called half-baked psychologists are treating autism more than our pediatricians are having. The number of patients they are having is much more than what we are having. And we know that they don't know the complete neuroscience behind the autism, its way of thinking and all those things. So again, it becomes important on our aspect to be in touch with the parent, to be little more communicative with the parent, be patient with the parent, and avoid this medical shopping. If you go on net, there are Ayurvedic medicines for speech in autism, and there are big ads on it. So naturally, parents are going to do that. Last week, one parent told my therapist, "Madam को बताना नहीं, पर हम stem cell therapy के लिए जा रहे हैं." So because I was telling her not to go, but some parent has given her some hope. So they said कि parent को मत बताना, लेकिन हम stem cell therapy का plan कर रहे हैं. So probably we need to educate ourselves, we need to empower ourselves to reach out to the parents, because we have much more scientific information. Similarly, there are certain people who will say that we have specific diets, we have some newer therapies, we do dance therapy, we do yoga therapy, we do art therapy, and parents are attracted to them. Again, it is not a scientific approach to deal with autism. So in all, more professionals who are not experts are dealing with autism than we, who are getting ourselves so scientifically aware of all the things regarding autism. But we should have patients in front of us. We should have parents in front of us. So the madam, which community case Nita Patil madam has told, we need to reach out to community. We have to show them that pediatricians are, a core part of the team. Only sending to OT. OT is just one part of autism, and getting OT rupees 600, 800 per day, half an hour, 1 hour, and parents feel कि इतने सारे पैसे खर्चे कर लिए, अब इसको कुछ करने की जरूरत नहीं है. So such type of, these are the facts which are happening in the society. So here, on all aspect, I believe pediatricians have a great role to play, right from educating ourselves, having a word with developmental pediatricians around. If there are no developmental pediatricians around you, you can have online sessions with the developmental pediatricians who are under the banner of IAP. So some or the other way, you can definitely get the services of experts, so that parents are guided in a proper way. Because it is a lifelong therapy. I repeat, it is a lifelong therapy. We see so many children, but we don't see adolescents. Where do they go? Where do they go as an adults? They just vanish. If you see 10 autistic children, you see 5 autistic students, you see 2 autistic adolescent and probably 1 autistic adult.
Right.
So they're lost somewhere. So we need to keep track about them. So this such type of programs, such type of activities where we are trying to reach to parents through various medias, I think is very important. And I must thank IIP Raigad and AHA Raigad for taking up this issue of teenagers. So when we talk about teenagers, we can actually go back retrospectively and plan our therapy right on the children which we are seeing today. So it is very important to know what challenges we are going to see later on. So in all, a very effective program, and madam's slides were excellent. And thank you so much once again. And if we have any questions, we can take up that questions. Thank you.
Thank you. Can I ask one question?
Yes, yes.
Yeah, it is, ma'am, regarding the centers which are there for adolescents or young adults with autism, and how they go about. Means, should a pediatrician interfere in their part of therapy? They are like finding out various ways to keep them engaged. Dr. Shilpa might be knowing some centers nearby Karjat area.
Yeah. See, these centers are mostly run by either some psychologists or some special educators. And special educators, because I have been a faculty for special educator course in Nagpur. So I know their level. I know how much they know about autism. Practically nothing, I would say. So a child who is growing up into adolescence is entirely in the hands of special educator or a psychologist who has done BA or MA, where autism is just a minor part of their curriculum. So if they're handling or if they're guiding parents, I think the intervention of a pediatrician or just to be in touch with them is very important. Maybe for guidance, maybe for some medication, and maybe because they are misguided, like stem cell therapy, Ayurvedic medicine, so many things are happening. So I think pediatrician must be in touch with them. It is mandatory.
There is one question in the chat box. One parent has asked, please explain strategies to be advised to a mildly autistic adolescent boy to face bullying in school and society.
Yes. So if he's mildly autistic and naturally maybe better high functioning, I think we have to use proper behavioral therapy.
Okay.
We have to use bit of dramatization in that. We have to just tell him empathetically think about the situation, because they cannot think from other person's perspective.
Right.
So if there are 2 friends, if one friend is doing that, what this friend will think, and if this friend is doing that, what this friend will think. So actually we have to talk with the child, and if he's a teenager, he'll be talking. Might be verbal because of its high functioning. And if we explain him, at the same time, we make a little bit of contact with that peer also, so that more sensitive towards this. So definitely we can work on both of them. Again, role of parent here becomes very important. And sometimes we have gone to the school classroom also to tell them that, this is the way you need to deal with this student. And children then accept, because they are, very nice in doing these things. They want to help others. And so if we can imbibe that feeling that, as a peer, you are supporting him, as a peer, you are helping him, you will be rewarded in some or the other way. So if that is being done, their acceptance increases. And a bit of acceptance will improve confidence to very high level.
Correct.
Just telling him कि ये मेरा friend है, मुझे तो कोई friend नहीं था, from he is my friend. It is really moral boosting for the child, and it is for that adolescent, and it is really helpful. So behavioral therapy, bit of CBT and bit of social skill training. Combination of these things will help.
Yes. Dr. Shilpa, you want to add something?
No, ma'am. Actually, that what I wanted to say is it has to be a multidisciplinary approach. When we say multidisciplinary, the pediatrician, the developmental pediatrician, the therapist, the
Right.
school teachers, everybody has to be involved equally. The parent, because what happens here is most of the times when a special educator is running those courses or giving therapies, they are not concerned about the medical issues. When or when the child is going to school, he is not he doesn't know what is going on in the therapy. So when there is a connection between everything, so the therapist can have a word with the teachers ki what is going on, how what we are teaching. So some of those activities can be imbibed in the class for the child to get better adjusted in the class. So if there is a multidisciplinary approach where everybody's point is taken, so maybe we can help that child in building his confidence and acceptance.
Yeah,
So
just a
this
word of
child,
caution. Just a word of caution. See, everybody has their own interest. And many times out of their own personal interest, they don't want to talk to others.
Okay.
Like OT person might not want to talk to special ed. ये मेरा patient ले लेगी. They don't want to. हम switch कर देते हैं ना madam. Yeah, even schools will say कि we want to retain because we have those 3% quota. You know, we have to show CBSE के इस पे हमको दिखाना है कि हम special students को ले रहे हैं. कब तक ले रहे हैं? 8 तक ले रहे हैं, and then they are dropping the child. So these vested interests are very much there. So again, it becomes important for pediatricians to guide the parent. Like, you know, finally the interest should be, decision should be parents, and they can take decision only if they are properly aware of the things. So pediatrician and parental interaction, I think, is the core issue.
Support group of parents.
Because we have OTs telling कि नहीं जाना उनके पास. You know, वो दवाई दे देंगे. Actually. So they have everybody has their own vested interest. So pediatrician parent dialogue is very important.
Okay. Madam, creating a support group for these parents of
Madam, you are
autistic
mute.
diverse children. Can you hear me?
Yes.
yes, ma'am.
Creating a support group in different areas, will it be a good idea in handling such issues? Because these are now adolescents. If these kids are now in adolescent age, further they want to pursue some educational field and work also as an adult. So few of them definitely will be working. High functioning adolescent teens can go in good fields, but society does not know how to get them accommodated at the workplace. So will it be helpful to form a parent group, parent support group, and then find out the way?
I think some network issues from my side.
Okay.
I'll just rejoin in a minute.
Okay.
Can I interrupt? As a doctor, as a pediatrician, we have seen autistic children when they come to our room. First of all, they are attached to particular doctor I have seen. They have to go to the same doctor. And you would have seen them when you touch their abdomen, they don't like the touch, you know, that they are very adverse to that. Many times they cannot point out the abdominal pain where it is. Shilpa madam, you are there. Tell us how we have to examine them. Many times I have missed appendicitis diagnosis because the child was not allowing me to touch the abdomen. And the appendical perforation was there. By the time we got the investigations done, there was a perforation. So those are the things, how to teach them that they're very sensitive to our touch also. And I'm very sure the autistic children who are attached to you, parents are forced to bring to you only because they don't get examined by anyone else. So that is our experience. And very rightly Jaya told, I think Jaya is not there. Jaya, you told rightly, where are the adults and where are the adult autistic, where they are going? What is the study about that? Whatever we are going to take efforts, what type of life they are leading? Shilpa madam, you should think. So now maybe India is changing and we are changing many things. I am fairly senior. There are many seniors with me. When we started practice, there's a big, maybe a debate whether the autism is increasing or awareness is increasing or environment is changing. All these three things are happening. And maybe we have to be more aware. 3% incidence is quite high, 3 or 2.5 or 2.8%. So we need to attend them. So infectious diseases definitely important. Examining the autistic child, that skill also should be taught to us by the neurodevelopmental specialist. It is very difficult otherwise to get any information from them.
So, ma'am, the what you said, that examining becomes a challenge, it is because of their tactile hypersensitivity. So these sensory issues which come into their way. So a child who has been uh, having a sensory integration therapy from the very beginning, slowly he gets adapted to that. But till that time, we don't have any other option. Like, even with, it is not necessary that the child is comfortable with the neurodevelopmental pediatrician, but not with the uh, pediatrician. Sometimes it happens with, even with the parent, they are not very much comfortable giving that amount of touch. So those are a challenge which we need to overcome by slowly sensitizing them to those sensory demands.
Can I interrupt, Chitra? There is one Dr. Chitra Shankar, who is a well-known neurodevelopmental pediatrician
Yes.
from Bangalore. Chitra Shankar, if she is there, I think she can open her video and comment your things. She is a senior. Chitra, if you are there, just comment.
Yeah.
Examination is very difficult, challenging for us. And
Yes. I'm very much here. Thank you so much, Dr. Geeta, for inviting me to say a few words. I was just trying to type in, and so what I wanted to add was that, as rightly pointed out, there are a lot of sensory sensitivities, and children are very difficult to examine. Few things that I would like to say is, they are also very sensitive to sounds, loud voices, loud talking, and all that. So try to talk to them in a soft voice first of all. Reassure them, give them little time to adjust to the environment before we go into, to touch them or something. If they are verbal, if they have adequate comprehension, we can tell them exactly, I'm going to check you. And if they are a little high functioning, definitely they can understand that much. Preparing them in advance, and those children who have some difficulty to comprehend the situation, visual pictures, etc., they have to be shown that before they are actually brought to the, if they are well enough, that is, if they are well enough. And if your hand is very cold, simple things like warming up your hands, gently approaching the child, giving them time, not scaring the child. Some children are very sensitive to the voices, to the smells of the clinic, the medical smells or the smells of the sanitizers, and all of them can also be major put-offs. So being aware of these things, that they do have these kind of aversions and sensitivities, itself can be an eye opener for the pediatrician, can help them to approach the child better. And preparing them, I think, in advance is one of the major things. A lot of people do that even before changing the school, changing the clinic, changing the doctor. You can show them things like dental treatments, eye appointments, because the doctor has to get very close to the child in these kind of situations. Getting very close for eye checkups, for dental treatments and all that. So these are challenging for the parents, for the clinicians, as well as to the child. These are some of the points I wanted to add. There may be other things. Keeping them distracted at this time would be helpful. Sometimes I do tell them, you have to use the screen when it is maximum, when it is most required, not all the time. Keep it for that period. So we do divert them at that time using some screens, gentle music, allowing them to carry something that they are attached to, like a favorite towel, a doll or blanket or something like that, allowing them to hold something of their, they are very particular, fixated on some objects. Allowing them to keep it in their hand or holding them would also be very helpful. So these are some of the things that have come to my mind.
Thank you, Dr. Chitra.
Yeah.
Overall,
Any question?
excellent presentation, and overall excellent deliberations and discussions.
Yeah. Now I think it is time to express our gratitude, and may I request our Joint Secretary, Dr. Neha Singh, to do the honors.
Dr. Sunita Ingre is already there, ma'am.
Yeah, Dr. Sunita, our secretary, please give vote of thanks.
Thank you, Chitra. It was a very insightful webinar with excellent academic deliberations and with touching different aspects of all neurodiverse children. And I have been assigned the pleasant duty of giving the vote of thanks. So let me begin by thanking our respected guest of honor, Dr. Geeta Patil, Madam, for giving us important information which is available, like IIP ki baat, community ke saath. And my express thanks to Dr. Shilpa Nambiar with wonderful presentation which she made and different aspects she touched. It was absolutely nice. Thanks to Dr. Jayashree Shivalkar, Madam, for she giving valuable and practical inputs regarding managing these special children. Thanks to Dr. Chitra Kulkarni, who is our IIP AHA, our AHA Raigad President, Madam. It is because of her untiring efforts that we could have this webinar today. My special thanks to Dr. Neha Singh for providing the valuable support, and Dr. Vikas More and Dr. Ajay Kohli for giving us this platform to conduct this webinar. And special thanks to Dr. Vishal Raut, who as usual is the tech support for our AHA Raigad. Also, special thanks to Nilima Bhandarkar for moderating this session so beautifully. And last but not the least, thanks to all the audience who have joined today online as well as on YouTube Live to be with us for this webinar. So thank you all for joining today.
Thank you, Dr. Chitra Shankar, Madam, also. She has
Yes,
also
yeah.
few inputs.
Yes, very
and
valuable.
it is very valuable input. Whatever the information which we got was really of practical importance, and it will be helpful for our day-to-day practice.
Indeed.